Next important point here is enhancing the rigor in quantitative studies. How you can make strong inquiries, okay, while conducting the quantitative researches, that we call it rigors. How to enhance that, how you get that your results are true, how you get that the results are trustworthy, reliable, valid, okay. So for that the word what we use is validity. So validity talks about the soundness of the research design and the method. While carrying out the experiment, the researcher has two objectives related to the validity. Number one, clarity of the impact of an independent variable on the dependent variable in a group understudy. Okay, what exactly the impact, how pure is the impact of independent variable on dependent variable. Okay, like example, if I'm saying exercise and weight, now how pure that weight, suppose somebody lost 10 kgs after doing an exercise for 3 months. So what is the role of the month? What is the role of a gender? What is the role of your diet? These factors. So because the weight loss of 10 kgs is not merely or not only is a result of exercise, but you should, whether your research design is capable to segregate the effect of these extraneous variable. Okay, that's the first question. Then make inference about the population as a whole. Means what they're saying, it's about generalizability. Okay, implications. How your results stand true over variation setting. If I conducted an experiment here and having some findings, whether if I repeat the same research in some other area, able to produce the same or similar results, that we call it this thing. What are the different types of validity? There are 4 types: internal, external, statistical conclusion, and the construct. As per your syllabus, we have a 2 in detail, and most important, that's the internal validity and the external validity. But we also will try to understand and try to define the basic of statistical conclusion and the construct validity. So if you talk about the first one, that is internal validity, it ensures results are due to the independent variable, not the extraneous factors. Like in that example, if I'm saying that 1.8 kg weight increase up to 2.4 kgs, okay, and there is an increment in a 600 grams, 600 gram in a 3 months. But if I see the another group, so this is a 600 gram increment, no? So this 600 gram is not only because of the tactile stimulation, this intervention. You have internal validity is something that talk about the purity of the effect of independent variable or on dependent variable. They try to how far your design is capable to segregate the effect of extraneous variables. Okay, that's the internal validity. It's about bond of strength or strength of bond between independent and dependent variable. Second is external validity. It allows result to be generalized across the different setting and the sample. That is the second point, external validity. Okay. Let's talk about the generalizability, how results stand true over variation in the site and settings. Then statistical conclusion validity, it confirm a true empirical relationship between the cause and effect. Yes, that should confirm that. Okay, there is a difference. Like for example, if I say there is a 1.8 kgs and now it's a 2.4 kgs, weight has increased in 3 months, but in a control group 1.8 to become a 2.1. Now there is a only difference of 300 grams. Now statistic will tell me whether the increment of 300 gram is statistically significant or it's just a natural random difference. Okay, so if you see the difference among groups, you have to ensure whether the difference is a natural difference, could be a random difference, or it is an experimental or significant difference. Okay, so statistical conclusion validity is all about that. And last one is a construct validity, that also verifies that the study measures the intended construct accurately only, nothing else. Like, if suppose I just want to study the empathy among nurses, And for that, I have to use certain tools. In that, I have asked a question, who develop a theory of self care deficit? No. Answering this question will not check the empathetic ability or understanding of someone. So this question should not be the part of this. So construct validity talk about ki whether your measures, your tools are truly measuring what it's supposed to measure. Okay, so construct validity is all about whether you defined your concept clearly, whether they are operationally adequate. So all these we talk in the construct validity. Okay, so that is about the 4 types. Now 2 will take in detail. So first is the internal validity, which already I have told you, it's about the accuracy of the results, which measure whether the independent variable caused the observed effect, whether the independent variable caused the observed effect. Okay, nothing else. When observed effects are under the influence of confounded by the extraneous variable, then it would not be easy to draw the valid conclusions. Now suppose if I have lost a 10 kg weight over a period of 3 months by doing certain exercise, there could be other things that might have interfered. Maybe I have started off losing weight in the month of December and now I'm checking it in the month of March. So because of the change in the weather, my diet pattern has changed, okay, or maybe some other factors have changed. Because of that, the weight might have reduced. So we have to see that whether independent variable is only the cause for that or is there any other variables. Okay, internal validity refers to the degree to which the cause and effect relationship based on the experiment is warranted. Please remember this. Internal validity refers to the degree to which cause and effect relationship based on the experiment is guaranteed. If I'm saying that tactile stimulation has increased the body weight significantly, means it is only tactile stimulation, nothing else. Okay, but whenever you talk about internal validity, it has certain threats. Threat means the things, event or conditions that affect the internal validity in a negative sense. So there are few of them. One is a history. What is a history? External. We'll discuss all that in detail in a subsequent slide. History means external event that influence the outcome. Okay, if suppose you are conducting an let's say an educational intervention in a village regarding the family planning, but at the same time the local municipal corporation also has launched the similar project. So now there is a more awareness among the participants. So it's very difficult for you to say that it is because of your intervention or something has happened naturally there. Okay, then the maturation, natural changes in the sometimes people show the behavior, participants show the change in behavior because they are more comfortable. Like if you want to conduct a study, the effectiveness of a motivational counseling on the anxiety among newly admitted students. So day one they would have a high level of anxiety and you have given some intervention to them, and after a month their anxiety level has come down. Maybe because of your intervention, but also because of the maturation. Now they are adapted to that situation. Now they are more comfortable to that. Okay, that is a maturation. Statistical regression, extreme scores moving towards the mean. That is another important point. Threats. Okay, sometimes like suppose there are people getting marks 2, 2, 2 and 2, 4 people, and one person got 8 marks. If you calculate the average of that, everybody will have a higher ranking. So that is also creating a kind of a confusion. Okay, so that is statistical regression. Then the selection, biased in the participant selection. That is also a big threat for internal validity. Let me remind you, whenever I say internal validity, you should understand that I am talking about what can affect the outcome variable other than the independent variable. So history can affect outcome, maturation can affect, statistical regression and selection. If you selected somebody, okay, by your own choice, like let's say I just have to have a intervention, okay, or where I want to see the effectiveness of a one particular intervention, let's say exercise, and I have made 2 groups, 5 students and 5 students. These 5 students are already going to gym, they are doing their exercises, versus those who are maintaining like low physical activities. So I have deliberately put 5 those who are good in exercise in one group in experiment, and another 5 in they are not good and they are having a low physical activities in a control group. So this will give a biased results. Okay. Then the experimental motility. Sometimes loss of participant during studies. If your study is for a longer time, sometimes people they leave it. Okay, so that is also something that affect that cause the experimental motility. Okay, so next is instrumentation. Change in the instruments that also affect the outcome. Let's say your mean blood pressure of 50 people was 128. Okay, in a supine position. Now after 10 days or after next day only, you check the BP of same people, but you change your monitoring machine, or you change the supine to sitting position. What happens? Suppose that now their blood pressure is 130. So this change is not because of the intervention you might have done. It might have changed because you change your instrument. Okay. Then the testing. What is that testing? Repeated testing influence the performance, like pre-test. Normally this happens when it comes to the level of testing. Like suppose there is a pre-test and there is a post-test. So when you have a pre-test type of things, pre and post, if suppose same 10 question were asked to somebody, okay, and because they have to answer the same question again after 10 days, which they have answered earlier, will make them sensitive, will create a memory effect. Okay, and that may change the result, that we call a testing. Then the design contamination. Sometimes unintended influence also can be, like if you're not adapted a good research design, it may affect the outcome. So these are some of the important threats. We'll discuss some of the threats in detail now. Okay, let's discuss these threats in detail. First is a history. So here we'll have 4 basic points. What is the name of the threat, its meaning, and which research design get affected, and what is the solution for that. History, already I told you some unanticipated event that may occur while experiment was in progress, and these events affect the dependent variable, the example which already I have given you. And one group pretest post design is being affected with this mostly. Okay, because like you had a pretest, and after pretest you have done some intervention, but somewhat similar intervention they have done. Many times this happened, so there is affected. So what to do? Use of control group. Have a use of control group. The example is a study to determine the effectiveness of assertive training program module, where the many subjects watch a television documentary on assertive behavior technique may affect the dependent variable. So what can be done? Always have a control group to manage this particular threat. Second is a maturation. The meaning already I have told you. Changes that occur in the subject during the course of the study that are not attributed to the independent variable, and that might affect the study results. Okay, and again, which design mostly get affected? One group pretest post design only. Solution is also the same. Always have a control group. So control group is a sanjeevani for almost all the internal validity threats. For example, the performance of student in learning experiment began decreasing after 45 minutes because of the fatigue. So now the changes is not because of your intervention, because of the fatigue. Or the previous example which I have given you, like somebody have a higher level of anxiety on a first day of admission in a college selection, that is another threat. What is the meaning of that? Group are not equivalent at the beginning of the study due to the non-random selection. So if you have not done random selection or randomization, random allocation, then all these designs can experience the selection threat. And especially the design quasi-experimental, where you have 2 groups but without any randomization. All designs use non-net probability sampling are the prone to have this threat. So what is the solution? Have a random sampling and randomization. It is also advisable to use a one group. Okay, so if you have only one group, there will not be an equivalency issue, but there could be some other problem, other threats. Okay, for example, the experimental group consisted of high ability classes while the comparison group was an average ability classes. So like that, this is what happens. Another threat is a experimental mortality. So differential loss of the participant across the group. Okay, Primary question. So, like loss of participant, what we call it attrition, dropouts, study dropouts. Okay, that is a mortality. Like somebody initially is enrolled for a research, but they could not sustain after intervention or even before intervention. Okay, so those design which are affected are longitudinal, means the design that proceed over a period of time. Okay, suppose you are conducting a design that will go for a 2 years or 3 years, or you will have a multiple point of data collection from the same subject like cohort study, time series, pre-test, post-test. These are the affected one, where you have to meet your participant a multiple point of time. So maybe first time he was available, second time he was not available. So solution is that you should have a design which are cross-sectional, retrospective, or only post-test design. Okay, if you are using these designs, you can avoid this particular thing. Like for example, in a health experiment designed to determine the effect of various exercises, to those subjects who find the exercise most difficult, stop participating. Okay. Then instrumentation. The instrument means the tools or technique what you are using. Changes occur in the dependent variable due to the inconsistent use of measurement. Okay, like I'll just give an example. Like two examiners for an instructional experiment administered the post test with a different instructions and the procedures. Okay, and like suppose there are 20 or 20 student group of first year, and this is examiner 1. This examiner 1 is evaluated by asking 10 questions, and this examiner evaluated them by asking the 20 questions. So they may have a difference, and this difference is not because they are really different, because the instrument which used by the examiner is different. Okay, and normally pre-test experimental design or one group designs are usually get affected with this, and solution is again control group and follow up standard protocols. This having a standard protocol means you have to structured plan, like what is the tool, okay, how it is going to administer, who will administer, okay, and what will be the conditions for that. So everything should be so structured and provide the basic training to the data collectors. So then with that you can maintain that. Then the design contamination. Outcome is affected because participant in the experimental and control group mingle up with each other. Sometimes this happens, no? If the participants are, staying in a close proximity, that is normally in nursing this happens, no? Suppose you are conducting a research where one group of nurses in a hospital is receiving an intervention and other nurses are not. So they will talk with each other what exactly is going on. Or students are staying in the same hostel. Okay, so or in the same room. So the person who was a part of an experiment will mingle up with the subject in a control group. Okay, so that is what we call it design contamination. So the changes in the control group is not because of the intervention, because they have contaminated. They have talked about that. So control group design and time series design. These are the commonly design which get affected. Okay, and what is the solution? One group designs. If you take this example, already I have told you. Now, there's another important concept. No, may not be much relevant to the undergraduates, but फिर भी let's try to understand internal validity and the data collection. Okay, so whenever you talk about the internal validity, especially about the dropouts, experimental mortalities, so two important things you should have the consideration. One is the selection bias. What is that? It is the bias introduced by the selection of the study subjects group of data for analysis in such a way that proper randomization is not achieved, thereby ensuring that the sample obtained is not the true representative of the population intended to analyze. It is referred as a selection effect. Okay, like as I give an example, you have taken the 10 subject in experimental group which are actually they are doing exercises, and now you want to see the effect of diet. And again in control you take 10 people, those who are not doing any physical activity, and again diet program. So they are not equivalent actually. You selected the faulty people. Okay, even I tell you, sometime you select you make a very strict inclusion criteria, like I'll take only those who speak English. Okay, speak English, or those who are literate, or those willing to participate, okay, or those who are cooperative or like that. You make this. Let me tell you a story of my own research. We have conducted a research where we wanted to know about the smoking prevalence among these collegiate students. And you know what happens? Most of the males denied to participate. Why? But whereas most of the female students accepted the participation. So we have around 200 sample. Out of that, 180 were the girls and only 20 boys. What would be the results? Result were that the prevalence was very less, because those who denied are different from those who accepted the participation in the research. This is what you have to see as a researcher. Whether those who have denied to participate are the same people, or do have any specific other characteristics. In this particular case, the males denied more to participate as compared to female. So we assume that they might be the smoker and they don't want to reveal it. Okay, so that creates a selection bias, and in that case they do not remain the true representative of the population. Now another thing here is a attrition bias, dropouts. In a continuation in the same only, it is a systematic error caused by the unequal loss of participant from the trials, RCTs. In critical trials, participant might withdraw due to the unsatisfactory treatment, efficacy, intolerable adverse event, or even death. So let me take an example for this as well. I have enrolled 50 nurse educators where I wanted to study their professionalism. Okay. And this nurse educator include MSCs, PhDs, and BSCs. BSCs, post-basics and all. Now I realize that most of the BSCs has dropped the study in between. Then, so out of this 50, there were 10 people dropped the study. Out of 10, the 8 were the BSCs. Why BSCs dropped the study? That is the question. So we have to see, dropout is a natural, people will leave your study, right? But if the dropout is random, like you can say that MSCs or BSc, everybody is dropping. Out of 10 dropout, there would be MSc, BSc, but here 8 were the BSCs. Why they dropped? Because the questions that we used to ask were not applicable to BSCs. Like for example, we were asking the number of publications, your CNEs, your membership of professional organizations. Okay, so these, they were new. So they were not able to answer these questions, or they don't want to answer that. That's why they dropped out the study. So whenever you see, like, let me take another example. Suppose you conduct a study on domestic violence and you find that most of the rural women had dropped out from the study as compared to the urban women. So now this is an indication that they don't want to participate. And now you have taken data from the urban or rural women, but whereas some of the women has denied to participate, maybe the typical case for you. Okay, so that creates an attribution bias. So attribution should not be biased. This is what I mean to say. Okay, so that's the point. Now what to do? When there are two ways to analyze the attribution bias. If there is attribution, if there are dropout, which is there, but if there is a bias, attribution is okay, but bias should not be there. Okay, if you fail to link the dropouts with the specific characteristics of the participant, then it is a natural attribution. But if you can see the pattern of bias, oh, males are more, dropping as compared to females or a specific population. So you can have two types of analysis that you can plan. One is a on protocol analysis and second is a intention to treat analysis. On protocol analysis is a comparison of the treatment group that include only those subjects who completed the treatment originally allocated. This approach is always towards the positive treatment effect. Okay, let me explain this with an example. Suppose you have enrolled the 50 people in a study, and out of 50, suppose 50 receive the intervention, but after the intervention, there are 20 people dropped the study and final was 30 only. According to this analysis, those who are dropped should be excluded from the study. So your study would be 30 pre and 30 post. You have dropped all 20, those who dropped. That is a on protocol analysis. Okay, and that is why, and why we say that it's a more towards positive bias, because those who dropped out may be the people who could not score much, or the people who know that they could not score. So that is a on protocol analysis. Second is more acceptable approach is the intention to treat analysis. It is a comparison of the treatment group that include all participants as originally allocated after the randomization. This approach assumes that each person received the treatment. Assume that. Now, in the same example, in a on protocol, I'll take 30 or 30 only. Okay. Whereas in this intention to treatment, I'll just take 50 for pre-test and 30 for I'll take a 50 for the post-test only. Means I will consider their pre-test score only as a post-test score. So this likely to produce the negative results, because they never appeared for a post-test. So whatever they scored in a pre has been taken as it is. We assume that they have received the treatment, even though they haven't received the treatment. So that is what we call a intention to treat analysis. And if you have an extensive dropout, you don't need to look for this. But if your dropout is biased, or if dropout is beyond the limit, like if dropouts are very extensive, then you can consider either on protocol analysis, where you only include those who received the treatment, or whereas in intention to treat, you include everybody, those who are enrolled, irrespective of whether they have received the intervention or not. We preferably I go for the intention to treat analysis. Okay, now we will talk about the another important concept, that is a external validity. Okay, so as we have seen, internal validity talks about the strength of bond between independent and dependent variable, whereas external validity refers to a degree to which the result of research can be generalized across the individual setting and time. This is what exactly we want. Okay, so suppose you did a research here, okay, in Chandigarh, and if someone repeat the same research, same intervention in some other context with some other population or subject, if the research able to produce a similar results, then we say the research is having a good external validity. And there are some threats to external validity as well: interaction effect of the testing, effect of the selection bias, reactive effect of the experimental arrangements, and multiple treatment interference. So we can discuss that in detail. Now, first threat is a testing bias. What is the meaning? Pre-testing interact with the experimental treatment and cause some effects, such as the result is not generalized to the untested population. Okay, and the common design is affected, one group pre-test post design. Normally what happens, suppose you did a research where a pre and post was done, and in a pre-test somebody score a mean score of 8. Okay, let me take mean score of, I said just say 4, and post is the person score, let's say 7. So this 7 could have the effect of this pre-test as well, pre-test sensitization. Okay, so pre-testing always interact. Already we have discussed that in statistical regression. So if you are answering the same question again, this may create a memory effect. So if you repeat the similar procedure in some other setting without having a pre-test, then result would be different. So what can be done to avoid that? Use the control group. One only post-test design you can use, or you can use the control group. Only post-test design we do not use the control group. Sorry, we do not have the pre-testing. Example, in a physical performance experiment, the pre-test clue that subject to respond in a certain way, okay, to the experimental treatment that would not be the case if there was no pre-test. Okay, so basically pre-test is giving a clue what someone has to perform. Okay, pre-test will tell what is the expectations actually. So testing bias will create that. Okay, then the selection bias. A group are not equivalent at the beginning of the study due to the non-random selection. Already I have discussed that selection bias. Selection bias will affect the results outcome. Okay, so quasi-experimental design, all other designs which are using non-probability could have that. So that is the one. So what to be done? Random sampling or randomization to be done. For example, the results of an experiment that is teaching method used with a class of low achievers do not generalize to heterogeneous ability of the students. So suppose if I have conducted a research here where most of the students were brilliant or having a above average IQ, if I repeat the same experiment in some low achievers, they produce the different results. Okay, that will affect it. Then another is a Hawthorne effect. What is that? An effect that is due to the fact that subject know that they are participating in the experiment, or that creates some kind of a novelty effect. Okay, Hawthorne effect, or what we call a expectation effect. Okay, you know that psychologically, if you tell somebody that this intervention will lead to some kind of effectiveness, and that may create a Hawthorne effect. Okay, so all the design which are affected, design with the blinding. What is blinding? Blinding is something where we ensure that the subject do not know about their allocation in the various treatment groups. They may not be aware that whether they are the part of an experiment or a control group. So what is the solution? You can use blinding or masking. You can have allocation concealment and placebo. Placebo means you can have a pseudo treatment for them. Like for example, if suppose you are giving a one particular type of medicine to a subject, somewhat similar medicine which have a zero biological impact can be given to the subject in experimental group as well. Okay. Next is carryover effect. Another important threat to external validity is a carryover effect. When the same subject receives a two or more treatment, then there may be the carryover effect between the treatment, and that can affect the external validity. Okay, such results cannot be generalized to the single treatment, and usually it is affected by the crossover or repeated measure designs. So what we can do? We can have a better washout period of control group. Let me give an example. So let's see the example. In a drug experiment, subjects are administered with the 4 different drug dose in a same sequence. The effect of second, though fourth dose cannot be separated from the possible delayed of proceeding the dose. I'll just take another example. Suppose if you're given an diet program, okay, to a subject, diet A for 1 month, then diet 2, a variation in diet again for 1 month, and then diet 3. Now with the diet 1, the subject has reduced 10 kgs, whereas with the diet 2, the subject has reduced only 4 kgs, and diet 3 only reduced 2 kgs because of carryover effect. Because initially after starting a diet program, most of the body fluid is lost. Okay, as you know that whenever you start a diet program, your initial loss of weight would be very high, very rapidly. So 10 kgs you lost immediately. But in the second diet program, it is not because you lost less, because second diet, because most of the things are carried out from the first only. That is a one. Okay, so carryover effect is that the effect of the previous one. So what can be done? If you really want to see such thing, you have to have a just washout period. Like for example, intervention 1 is given for a month, 1 month, then keep 15 days, or depending on what kind of intervention you are doing, washout period. In that, the intervention will not be given to the group, and after that again you give a intervention 2 to the subject. Okay, so that is a carryover effect. Novelty effect, there is another important thing that affect the your external validity. Novelty effect occur when the participants in the study behave differently simply because they are the part of research study, okay, which may not be reflect how they would be in the real situations. Okay, this is another important threat, and this always talk about experimental designs. Mostly they are creating artificial situations. Okay, so novelty effect is that, like somebody, as I have discussed that here Hathorn effect, where somebody having a psychological effect of something similar to that is a novelty effect. Because if suppose you have given intervention by saying it that this diet, it will reduce your body weight significantly, and that will create a novelty effect. Okay, so one group pretest poster designs are mainly affected. Okay, and what can be done? You use the blinding. Blinding means you should not tell your subject what kind of treatment they are receiving. Okay, there is one more important point that we'll discuss later on. Allocation concealment to be done. Okay, allocation concealment means where subjects are not aware what kind of treatment they are getting. So that is about the threats, various threats to external validity and how we can overcome with these. Now, by having the control or measurement of external or internal validity, or by controlling these threats, you can enhance the internal validity, where you are more confident to say that your outcome is only and only because of your intervention. And when you repeat the same experiment by putting variation in the setting, by changing the setting and subject, you are likely to get a similar results, that is external validity. So that's all for today. Thank you.